Hospice or palliative care? Do you know the difference? Yes, there is a difference between hospice and palliative care, at least in the United States. And knowing the difference will help you be less afraid and help you better make choices at the end of your life. So now I'm going to tell you how hospice and palliative care are different and how they're alike. So first, let me explain hospice. So since hospice is federally funded, every hospice company should basically be acting the same. Medicare is our boss. Medicare says what we can do, what we can't do. So in general, every hospice company across the nation should be functioning the same. In order for people to come on to hospice, there are some guidelines. It depends on why you're coming on to hospice. So depending on what disease you are coming on to hospice for, but in general, you have to have less than 6 months to live. Who says that? Usually your doctor, but also you, if you have a terminal illness, can call a hospice company on your own and get an evaluation on your own if you choose. But usually your medical team is involved. So you have to have less than 6 months to live if you want to be on hospice. And then of course, there's specific criteria depending on what disease you're coming onto hospice for. Another thing is you cannot be going to the hospital. So if you are on hospice, you are not allowed to be admitted into the hospital. If you are admitted into the hospital for whatever reason, you will automatically come off hospice. So if you are hospitalized while on hospice, you are automatically taken off hospice. Why? It's because Medicare is basically giving you, or the hospice company, a lump sum of a benefit over here saying, here's your hospice benefit. But if you come into the hospital, you have to come off this hospice benefit. So now your insurance or Medicare can pay for the hospital stay. It will not do both. At least right now, hospice is separate. So if you are on hospice, it's its own benefit from Medicare. So in order to get into the hospital and have it paid for, you have to come off hospice. So we can't leave that to the family to remember and to decide that. So if it just happens, we just automatically take someone off. It just automatically happens, which is good because then your hospital stay can be paid for. I always say to families, of course, we don't want your loved one to go into the hospital, especially if what you want is for them to be comfortable and in their home. But if push comes to shove and you do get admitted into the hospital, it's okay. And you just come off the benefit period for that hospice stay and you go into the hospital. And when you come out of the hospital, you can always come back onto hospice. So one thing that hospice does provide is DME, which is durable medical equipment. It means a hospital bed, a bedside commode, a wheelchair, a walker, all types of things. It's all free and it's all provided by Medicare. Now, because Medicare is paying for it again, there is like a specific list that Medicare will allow us to do and then things they won't allow us to do. So, and that's across the board, across the United States. We have to listen to what Medicare says we can and cannot order you. But in general, you can get medical equipment in your home for free from hospice. Another thing we supply is supplies. So bed pads, briefs, gloves, no rinse soaps, all different types of things that it depends on what you need and what your loved one needs and what the patient needs. But we do supply supplies. And again, this is Medicare driven. So Medicare is our boss. We can only give you what they say we can. And there is a list. So there's some red tape to get through, but in general, we can supply you with a lot of things for free from Medicare. Medicare also supplies medications. And again, there is a list of things we can and cannot. Also, we can get the medications delivered to the home so you or your family member no longer has to go to the pharmacy and get those medications. So in general, with hospice, you have to technically have less than 6 months to live. Now, this is disease specific. So there are like terminal chronic illnesses like congestive heart failure, Alzheimer's, dementia, Parkinson's disease, where you can come on to hospice with technically 6 months or less to live, but you have to meet other criteria as well with those specific diseases. And with those specific diseases, people can tend to stay on hospice longer and even come off hospice and come back on hospice, which is also allowed. Certain types of cancers, pancreatic cancer, usually cancers metastatic to the liver, glioblastomas. I mean, it all depends, but there are some cancers that can be terminal and end of life, and that also has to have other criteria per Medicare guidelines. This is stuff that you don't need to know every little bit, every little detail, because that's a little too much, but just so you know, there is specific criteria for specific diseases. So hospice is mostly in people's homes. You can go to hospice facilities in certain states, but also most hospices are in your home. And most of the work falls on the family, which I think is a huge misconception. Most people don't know that. So if you are going to have hospice in your home, your family will be the ones caring for you most of the time. What hospice does provide is a team of people to come into your home intermittently when you need them. So that's a doctor, a nurse, a social worker, a home health aide, someone to bathe you and get you changed and dressed, and a chaplain or like a spiritual counselor if you choose. We also provide you with a 24-hour number where a nurse can come out to your house, even if it's 2 in the morning or whatever time, Christmas Day, whatever, if there's issues. So that is also provided with hospice care. So what is palliative care? The elusive palliative care. Everyone has many questions about this, and I understand because it's a newer concept and it does differ from agency to agency, hospital to hospital. So what I'm going to say in this video could be different than your hospital or your agency. But in general, generally speaking, what palliative care is a symptom management program. There is criteria, and that criteria changes from agency to agency. In general, we would say someone on palliative care does probably have something terminal. So whether it's a year, 2 years, we don't know, but there's usually some kind of terminal or chronic illness that causes tons of symptoms. They either have a lot of symptoms because of the disease or they have a lot of symptoms because of the treatment of the disease. So they use palliative care to have better symptom management. Anyone with a terminal or chronic illness knows that you have symptoms and you kind of go in and out of the ER, in and out of urgent care. You have exacerbations where you're really sick for weeks and then kind of fine for weeks. And palliative care's whole purpose is to take your disease that's like up and down like this and make it more steady. Palliative care is to look at the person as a whole and try to help manage their disease and manage symptom management, pain management, so you don't have to spend all of your time in ERs and urgent cares. Again, we provide you with a team of people, a doctor, a nurse, a social worker. They may be able to come into home. They may not be, depending on the agency. They may give you a 24-hour number to call for a nurse to come day in, day out if you like, just like hospice, or they may not. That's where agencies differ. In general, if you can get onto palliative care, if someone offers that to you or your medical team says, we should try palliative care, I would always suggest you do it. To me, there's like no downside to palliative care. There's no downside to me for hospice either, but with hospice, you can quote unquote lose things, right? You can't go into the hospital. You're not supposed to get chemo and radiation. With palliative care, you can do all the things. So you can be getting treated for your cancer on chemo, radiation, a surgery planned, and still be on palliative care. You can be admitted into the hospital and still be on palliative care. You don't get all of the things in the sense of equipment in the home or supplies or medications delivered. Some agencies won't give you that nurse that can come visit you in the home with palliative care, but you will still have a team kind of helping you manage your symptoms and keep you at home most of the time. If you are trying to choose between hospice or palliative care, number one, talk to your doctors, talk to your medical team, see what they are suggesting for you. In general, if you are still getting treatment for your terminal or chronic illness, you may want to consider palliative care because again, this is something where you can still get chemo and radiation and be on palliative care, whereas with hospice, you cannot. If you're in this situation and your doctors aren't talking to you about hospice or palliative care, but you're curious, ask. Ask them, talk to them about, do they have a palliative care option? What do they think about hospice? Where do they think you are in your disease? How do they think your treatments are going? Do they think either of these programs will benefit you? And you can make your choice from what they say. So now I'm going to answer some of your questions. Thank you for the question, Kathy. Let's dive a little deeper into that question. This is a gray area. Palliative care and hospice is gray. It's not necessarily cut and dry always. So palliative care is for symptom management. However, a lot of people on palliative care will be eventually transferred to hospice. I want to be able to give these black and white answers, but in general, if I did, I feel like I'd be doing everyone a disservice. Asking questions about this is not uncommon because it is a gray area. So palliative care is not an end-of-life program. However, a lot of people in palliative care do have terminal illnesses. You definitely don't have to be dying to be on palliative care. It can be a symptom management program, and it can be a program where someone may eventually transfer to hospice. It all depends on the person, and it all depends on how your facility is running palliative care. Oh, Green Acres is the place to be. I feel you with this question. I get this question all the time. Let's get into it. End of life is tough. So in general, with your mom, who is elderly because she's in her 90s, it's tough. People who are elderly in their 90s that don't technically have a terminal diagnosis, but are elderly and have had a fall and broke a hip and are in pain, they can fall through our medical system's crack. And that is the problem with our medical system. We don't have a program that suits elderly people that are just having some issues because they're elderly and they had a fall or they got an infection or whatever. So can she qualify for palliative care? Probably, and I would talk to her doctors about that and talk to her about it's just a symptom management program to help manage her pain and hopefully help her rehabilitate so she can go home at some time. Or if not go home, at least walk and not be in pain. But unfortunately, I see this a lot with elderly people. They don't qualify for either program because there isn't something terminal. I don't necessarily think that's right, but that is where we are in our healthcare system. My advice to you, just as a person, would be to talk to her medical care team about your concerns and see what options they have for her. No garlic, please. Thank you so much for your question, and I'm really glad you're here. So let's get into it. People can die on palliative care because a lot of times people are afraid of hospice, or they will deny hospice because hospice gets such a bad rap, and they hear the word hospice and they think, oh no, I'm not going on to that because I don't want to die. And if I go on to hospice, I will. So they will not go on hospice and just go on palliative care because then they can get their symptoms managed still get a lot of benefit from the program, but not technically be on hospice. That is okay for some people because I understand. I am here purposely on this channel just so I can try to change that. Likely your friend probably could have been on hospice, but maybe was afraid or didn't want it. Or maybe there are some people who just surprise us and die sooner than we thought they would. Hi, Brenda. Thank you so much for your question, and let's get into it. So the big difference between hospice and palliative care in a general way is that hospice is end-of-life focused. It's an end-of-life program where we're trying to help you live out the rest of your life and die a peaceful death. Palliative care is symptom management. We want to help you live with this disease that you are having symptoms from, or from the treatment from the treatment you're getting for this disease. And we are trying to help manage those symptoms so you can live a great life while also having this disease. So hopefully after this video, you guys understand that hospice and palliative care are not bad words. They are programs here to help you. Let me know what other questions you may have in the comments. And as always, don't forget to subscribe for more death and dying information.